World DigiHealth and Wellness Forum. We welcome all of you. Very good morning, ladies and gentlemen. On behalf of the organizing committee, it's my great pleasure to welcome you to the World DigiHealth and Wellness Forum, the virtual edition 2024. Before starting this session, we would like to thank our sponsors and partners to the event. Without your support, the event would have not been possible. Special thanks to the platinum partner, Abe Health. As of now, I could see that we have an astounding number of 560 visitors on our platform who are viewing the event live. So we would like to thank our esteemed guest present today with us, Ms. Latha Ganapati, IAS, Director, National Health Authority of India, National Health Authority, Government of India, Mr. Naveen Seth, Deputy Secretary General, PhD, CCI, Mr. Saugat Chatterjee, CEO, Abe Health. The convergence of digital technology and healthcare has revolutionized the way we approach wellness, providing innovative solutions and opportunities to enhance the quality of life for individuals worldwide. The virtual edition of the World DigiHealth and Wellness Forum serves as a platform for thought leaders, industry experts, healthcare professionals, and stakeholders from across the globe to come together, exchange ideas, and explore the latest developments in the digital health and wellness. We have curated an exciting agenda featuring keynote presentations, panel discussions, and some of the interesting networking sessions focusing on various aspects of digital health and wellness, including telemedicine, wearable technology, AI in healthcare, mental health, remote patient monitoring, and much more. As we embark on this journey together, I encourage each of you to actively participate, share your insights, and engage in meaningful discussions. Let us seize this opportunity to collaborate, inspire, and drive positive change in the realm of digital health and wellness. I would like to express my deepest gratitude to our distinguished speakers, sponsors, partners, and attendees for their unwavering support and contribution towards making this virtual forum a reality. Without further ado, let's dive into the enriching sessions ahead and let us exchange the knowledge and ideas begin. Thank you once again for joining us at the World DigiHealth Wellness Forum Virtual Edition 2024. Together, let's pave the way for the healthier and more connected future. Wishing all of you a fruitful and memorable experiences. Thank you so much. And now we'll move forward to our partners for the event, PhD CCI, PhD Chamber of Commerce Industry, and kindly allow me to welcome Mr. Naveen Seth, Deputy Secretary General, PhD CCI, to say a few words, please. Thank you so much, sir.
Thank you very much, Mayank. Good morning to all of you. First of all, I'm really sorry that I am traveling in the car. I have to go for a meeting. So there might be some disturbance. So esteemed participants, distinguished guests, and respected colleagues. So I'm really happy to be part of this event today, which has just started. And I think our partnership with the GECI is going to go a long way. And I, on behalf of PhD Chamber of Commerce and Industry, welcome you all for this. So I think in today's dynamic business environment, the integration of technology into healthcare and wellness solution is not just a trend, but a necessity. The World DigiHealth and Wellness Forum provides a unique platform for us to collectively explore the vast opportunities that digital advances offer in transforming the landscape of healthcare delivery and wellness management. Our partnership is a testament to our belief in the power of collaboration to drive positive change. The PhD Chamber is dedicated to promoting economic growth, sustainable development, and technological innovation. By aligning ourselves with the initiatives like the World DigiHealth and Wellness Forum, we aim to contribute to the disclosure surrounding the pivotal role of digital technologies in shaping the future of healthcare and wellness. I would like to express our sincere appreciation to the organization's fellow partners and participants for their dedication to making this virtual edition a reality. Together as partners, we look forward to playing a meaningful role in advancing the dialogue and facilitating the exchange of ideas that will shape the future of digital health and wellness. As we embark on this journey, I encourage each one of you to actively participate, share your experience, and build connections that will extend beyond this virtual forum. Let us collectively harness the potential of digital innovation to create a healthier and more connected world for all. Thank you for your attention, and I wish everyone a successful and enlightening experience at the World DigiHealth and Wellness Forum Virtual Edition 2024. Thank you very much.
Thank you so much, sir, for the kind words, and thank you so much for joining us even when you're traveling. So it's an honor to have you with us, sir. Thank you so much. So up next we have our platinum sponsors. As we always say, Abe Health presents the World DigiHealth Wellness Forum. Please allow me to invite Mr. Saugat Chatterjee, CEO Abe Health, to take the discussion forward. Sir, over to you.
Thank you, Mayank. Thank you so much. And a very good morning and a warm welcome to all the participants and the attendees of this event. On behalf of Aware Health, I welcome all of you all to this edition of WDWF 2024, which is World DigiHealth and Wellness Forum. This platform is not only a platform of interaction and knowledge sharing, but the intent of this platform has been made in order to create a long-term sustainability in terms of collaboration, growth in the space of healthcare. And when we talk of healthcare and the digital version of healthcare, we often understand that, DigiHealth is all about innovation. It's all about AI-driven exercises. It's all about data interpretation and how to kind of measure the various body vitals. But then the endeavor which this platform is going to provide, and at the same point of time, the endeavor which also falls in the same alignment of other health, is the endeavor in which we are trying to ensure that the digital version of the health leads more from a preventive to informative to curative. And that's a transition which we are going to make in this journey. And our health is proud enough to participate, collaborate, and be a part of this extensive journey with all of you all together, where we can do a much more meaningful integration of business in terms of impacting the consumer life, the patient's life, and also the life of those who are attending to the patients in a much more simplified, constructive, and yet meaningful way, wherein digital innovation can impact and help all of them in the journey together. At the same point of time, I would also like to take this privilege to update all of you all that Aber Health as a company, we have brought into this industry a range of very innovative product range, which includes products from the range of rapid testing kits, which includes pregnancy, ovulation, dengue, malaria, HIV, and the list goes on. And with the same point of time, we are also bringing in a range of OTC home use and personal hygiene product category, which includes antiseptic liquid, fast band-aids, cotton balls, cotton buds, sanitizers, uh, fruit cleaner, home cleaner. So a range which will ensure that, in our lives and the times to come, how through our brands Assure and our brand Act Fast, we impact this lives of all the people, wherein, as we always say, prevention is better than cure. So therefore, there is no other better alternative than to have a preventive health opportunity into the entire healthcare synopsis. And as we keep saying that, as a punch word which we often use in our communication, that in our health, we say that be assured and be healthy. So with that note, I wish all of you all good health and happiness. And once again, as a part of this forum, as an organizing committee, and also as a part of the sponsor for this forum, our health wishes everybody, all panels and speakers, a wonderful session and a day together. And I'm sure we will continue this association in the long times to come. Thank you so much.
Thank you so much, Mr. Saugat Chatterjee, for the enlightening words and it's really setting the mood for the event. So we'll in fact request you to kindly stay with us till the end because there are a lot of insights which is going to come from Abe Health about the new advancements which are happening in terms of the medical technologies to go with. So thank you so much, sir. So I would request the team to kindly allow Miss Lalita Madam to kindly join in. She's already there in the waiting room. So up next, we have our guest of honor for the day, Ms. Latha Ganapati, IAS, Director, NHA. I would request the team to kindly allow her from the waiting room, please. We have her colleagues along with us, Ms. Deepika Rawat and Ms. Sandhya, who have joined us. Very good
Very
morning,
good morning.
Ms. Lata
Am I,
Ganapathy ma'am. Request to kindly take the discussion forward, please.
am I audible? Am I audible?
Yes, ma'am. Yes, ma'am. You're audible.
I'm traveling. I'm in a field inspection with respect to some urgent work from Prime Minister's office. That is,
Okay.
so if my signal is poor, I'll switch off my camera and talk.
Okay, no problem, ma'am. Thank you so much for joining at such a short notice as well, and thank you so much for making yourself convenient to be with us today.
Yeah.
Thank
Should
you.
I wait for my turn or
Yes,
some? Yeah.
ma'am. Yeah, it's your turn to go ahead. We are already live. Thank you.
Okay. Okay.
Over to you, ma'am.
Yeah. Good morning to all of you. I want to extend my heartful thanks to the forum which has given me this opportunity to put forth my ideas and the stand of NHA and what NHA is doing towards digital health now. Okay. Actually, National Health Authority, we are the part of Ministry of Health. We have two mandates to do before us. One is that Pradhan Mantri Jan Arogya Yojana, and digital health mission is another project we are carrying on. You know very well that the government is decisive to give the quality healthcare to the people of India, and that too with a vision of universal health coverage and with the platform of digital ecosystem. This is the overall picture what NHA is doing. Pradhan Mantri Jan Arogya Yojana is insurance, public insurance scheme. It's a world's biggest health insurance scheme, public insurance scheme covering nearly 60 crores people. And it is a centrally sponsored scheme with a 60% financial contribution from Government of India and 40% from state government. You know very well that any person who is in the lower bottom of the economic structure is always under the threat of health issues. Whenever his family is pushed into the health issues, he is further pushed into the poverty line. The out-of-pocket expenditure for the health issues is the biggest threat in any normal Indian citizen's life. To address this issue only, Pradhan Mantri Jan Arogya Yojana has been launched. Now today it is covering nearly 60 crore people. As on date, we had 6 crore admissions worth of 77,000 crores, which is equal to 10 billion USD. And this entire insurance coverage happens in a digital platform wherein the claims are adjudicated on a robust digital platform, wherein all the 39 states except 3 states have all joined in this health insurance scheme. They've converged their own insurance scheme with us, and today we have treated almost 6 crore patients, 6 crore admissions so far. And as I already mentioned, 77,000 crores worth of money has been spent on this. How do we do? Any patient who is in the SEC database, that is socially economic vulnerable group, people are identified and added in this group. They've been issued with the Pradhan Mantri Jan Arogya Yojana health card, which also happen on the digital platform only. People are identified in the field through the app. Their verification happens based on the Aadhaar ID, either on the fingerprint or on the OTP mode. They have been verified and they are added in the database, and the card is issued to them. The card holder can any hospital get admitted and get the treatment. 28,000 and odd hospitals are empaneled. Even the empanelment happens on the digital platform. So robust platform we have. through which we have nearly some 2,000 and odd packages we have, which is in the back end of the software, and every one is treated according to their ailment, and the claims exchange happens on the digital platform. So this is how the Pradhan Mantri Jan Arogya Yojana happens. For quality care, we have NAFU triggers, which are AI-based triggers, which identifies the fraudulent issues also. And this is a dynamic process wherein we day to day we develop new triggers and find out any kind of fraudulent, and we prevent the misuse of the claim submission by the hospitals. This is one part of the Pradhan Mantri Jan Arogya Yojana, which is now the scheme of the Government of India, which is protecting the rural mass from getting into poverty because of the health issues. So we have been implementing this successfully, and we have been improvising this on day-to-day basis. However, the future of India depends on the digital world. And the health sector, of course, the big sector has to be on the digital platform only, based on which already in 2018, Honorable Prime Minister has launched the digital mission, which we are now promoting from 2018 onwards, which has got 4 building blocks, namely ABA. Every citizen of India will have a unique health identifier number, which is called ABA, which is created through an app or in the website in a digital platform, followed by HPR, HFR, and HMIS. HPR is the facility, the registry for the health professionals. HFR is the registry for the health facilities, which has to be registered under this platform. They are all connected by HMIS system, wherein all the transfers will happen through in the digital platform. When any facility joins in this ecosystem, the cross talking between the facilities, between the individuals is quite possible. So Ayushman Bharat Digital Health Mission is now adopted by all the 36 states, and we have been in the process of adoption of public hospitals as well as private hospitals. The public hospitals have been encouraged to register their HPR and HFR, and they've been encouraged to adopt HMAS, which is ABDM enabled, so that they will be part of the digital ecosystem. Same way, private hospitals also encouraged to have the HMAS, ABDM enabled HMAS, and they've been encouraged to register their HPR details. And we have been giving certain incentives like a digital health incentive scheme, where every hospital, whenever they share a registry record, they'll be paid to ₹20. And the public hospitals are earning crores of rupees through this incentive scheme, which is encouraged for the adoption of the ABDM. Once this for the entire health system to become a digital ecosystem, we are almost in the bottom edge of the implementation. That is, now the awareness is spreading throughout India. Because of this, now the public hospitals are becoming HMAS enabled, and private hospitals are becoming aware of this scheme, and we are encouraging this through the microsite adoption also, wherein 500 to 1,000 health facilities are there. They are declared as microsites, and there will be a handholder who will be going and marketing about the digital health mission, and they'll be encouraging the adoption of the scheme. This is how the digital health mission is functioning, and it's a long way to go for us. Once the adoption is completed in India, we'll be completely on the digital platform. the important factors, the ABDM, which conceptualize, ABDM has conceptualized three important factors, that is Unified Health Interface for Services, Health Information Exchange Consent Manager for data, and National Health Claims Exchange for claims. These are the main three conceptualizations we have done on this technological stack. So we'll be looking forward for a digital transformation of Indian health system in near future, which will happen in another few years. With this, I'm closing my remarks. I'm on my way to another district to see some health facilities. Thank you very much for your patient listening, though I'm I'm not good in delivery. I'm very poor in communication. Anyway, whatever I wanted to communicate, I hope I have communicated to all of you.
Yes, ma'am. Thank you so much, ma'am. I think it was wonderful to have you with us. Your insights were really important because there are many schemes from the government which are unknown or which are yet to be basically floated in the market as well. So at least with your initiative, people will get to know more about the new initiative which the government is taking to make the health system better. And apart
Actually,
from that, I would also like to mention that we have approximately 680 people who are viewing us live right now. Any questions regarding the discussions which ma'am has put forward? Request you to kindly put your notes and put your remarks on the question form which is there on the platform itself, so that we can bring it forth to ma'am and see what possible arrangements can be done in terms of answering your questions too. And ma'am, thank you so much. I think the world have really seen the worst of the health issues during the COVID times. And India definitely was one of the countries which came up fighting very hard with the digital health schemes which was there. And I think we were one of the best controlled countries in terms of the COVID-19. And salute to the whole National Health Authority of India and all the doctors and all the people who were involved in fighting that the fighting that situation at that point of time. So thank you so much, ma'am, for your time, and we really look forward to connecting with you in future as well.
thank you so much. Thank you.
Thank you. So before we come to the next panel, I would like to thank all of our members of the inaugural session, starting with Mr. Naveen Seth, Deputy Secretary General, PhD, CCI, Mr. Saugat Chatterjee, CEO, Abe Health, and Ms. Lata Ganpati, IAS, Director, NHI. Without your support, we couldn't have actually moved forward. Thank you so much, sir, for joining us, and really hope that we could connect in future as well and make more opportunities available when it comes to the World DigiHealth Wellness Forum.
Yeah, sure, sir. Thank you, Mayank. Thank you very much.
Thank you, sir. Thank you. Take care.